In volleyball, our knees often hurt. Sure, our knees are heavily loaded. We jump almost every day in practice, in matches. Sometimes our knee problems can only be solved with surgery. And nobody wants to have surgery. So what you should do to keep your knees fit and avoid surgery? One of the most critical factors is proper technique. Not just the correct volleyball technique, the technique of jumping, landing, running and moving during the game, but also the right technique during workout in fitness. The poor technique creates movement patterns that can transform into injuries after some time. Imagine you are jumping for a spike. You want to jump as high as you can. So you make a big fast steps and you jump. Sometimes this jump isn't just high, but many players jump rather far and actually fly through the spike. And then when you land, you don't just land vertically. Your shoes and feet have to cushion not only the force of the impact from the height, but also the force of your long jump. So you need to jump on a court that's not dusty. Otherwise, your foot can slip on an impact and you risk injury. You also need to have shoes that will cushion your long jump. And of course, this impact puts stress on your knees, meniscus and ligaments. And if you perform this improper long jump 50 times in a training session, several thousand times in a season, you put yourself at greater risk of knee injury due to improper jump technique. You can get into a similar situation in the gym. Coaches ask you to lift heavy dumbbells while squatting. Yes, the squat is an excellent exercise for jumping and increasing your high jump. But what if you are doing it wrong? What if, for example, your knees are in the front of the toes of your shoes when performing a squat? Again, you are in the wrong position, working on the improper technique. And by performing the improper technique, you are again increasing your risk of injury and possible surgery. So focus on proper technique first. Good technique is most important. Once you have it, then add on the height of the jump and complexity of the exercise or the weight you have on your back when squatting. I have already mentioned the issue of strengthening and strength. The stronger your body is, the better for you and your knees. By no means do I mean that every volleyball player should have legs like a bodybuilder. They don't. You don't need the biggest muscles. You don't need to be able to do a deep squat with 300 kilos. But you need all the leg muscles strong. If we are talking about preventing knee injuries, the quadriceps and hamstring play a vital role. Strengthen these muscles regularly, preferably slowly and eccentrically, with the movement of the weights moving towards your body slowly for 3 seconds, and if you drop the weight again, slowly down for 3 to 5 seconds. That's the advice if you have access to a gym. There are plenty of other exercises on YouTube to strengthen your hamstrings and quadriceps even without going to the gym, just using your body or an elastic band. Once you have solid hamstrings and quadriceps, you can perform lunges, squats, leg presses with more weight. But again, weight is not crucial. You need to have good technique first, then you can increase the weights. Improving flexibility and mobility is also extremely important if you want to prevent knee injuries. I know a lot of players who don't stretch before training. They say they are stretched enough and stretching is a waste of time. Once they are in the hall and they see the ball and the net, they are already attacking the ball and they want to hit hard. Many of these players end up having knee surgery eventually. In practice or in a game, we all try our best, we play our best, and if we are giving it our all, we are pushing ourselves to our limits, to our volleyball limits, but also to our limit positions. Sometimes we have to jump for the ball far on the court, sometimes we want to block the opponent and we end up close to the net. If we have shortened muscles and the lack of body flexibility, it is in this limit situation that our risk of injury increases significantly. Therefore, from the beginning of your not only volleyball training, do not skip stretching. Ideally before and after training, if you stretch, you will again reduce the possibility of muscle and knee injuries. We often forget to work on stability, which goes hand in hand with joint mobility. Exercises and training on beach volleyball courts are great for improving knee and ankle stability. Also, many top teams start their long indoor season with preparation on the beach. You won't get sore ankles and knees from the sand. You are moving and landing in the soft sand. But at the same time, you are engaging deep muscles to balance the instability and positions you find yourself in during volleyball drills on the sand. BOSU and exercises on similar unstable gear are also excellent for developing stability. It's similar to the weight room. You can just focus on one exercise. Stability needs to be worked on over a long period of time, performing easy, mostly static exercises that strengthen the deep muscles of the knees and ankles. These exercises will help you prevent small and larger injuries in the long run. This is precisely what we need to be able to play volleyball without restrictions, without injury and possible surgery. Regardless of the activity we are doing, a proper warm-up is necessary. It doesn't matter if you are training for a sprint, a marathon or a volleyball match. Our bodies don't go from 0 to 100% in 5 seconds. We need to warm up our bodies, prepare our muscles and everything else for the next exercise. But not only do you need to warm up at the beginning of the practice or the match, you should also keep your body warm during tournaments or games. Sure, if you are playing beach volleyball on the beach where it's 35 degrees, it will be easy for you to warm up. Just a few minutes and you are sweaty. But I am sure you know a lot of volleyball halls tends to be underheated in the winter. If it's 15 to 18 degrees in the hall, keeping your body warm isn't so easy. Sure, sweat pants or compression leggings will help you, but on the other hand, playing volleyball in the sweat pants isn't comfortable for everyone. That's why even in these cold indoor environments, keep your legs, muscles and knees warm so you can make quick volleyball moves. Quality shoes are often overlooked, but they definitely contribute to our knee health. As I mentioned earlier, the stability and mobility of our ankle is key to absorbing the forces and energy of impact and fast movements. If you don't have appropriate footwear, these forces will not be absorbed and distributed as they should be. This leads to additional excessive stress on the knee. Let's face it, comfort and fashion are often the determining factors for volleyball shoes. But I would advise you to get a shoe that is stiff enough to be supportive during side-to-side cutting, as well as allowing your heel to sit deeper in the shoe. That will add stability during plyometric moves. It's great to have beautiful shoes that no one else has, but if it's a shoes that's not suitable for volleyball, expect a higher rate of ankle or knee injuries. Also, you can't use one-size-fits-all shoes for all sports. Invest in quality volleyball shoes to avoid potential problems. These do not have to be the top models. If you play in the shoes 2 or 3 times a week, they should last you 1 season. If you practice and play more often, it's better to have 2 pairs of the shoes that you can alternate. There's a lot of talk about knee pads in the volleyball world. Some say you don't need them. The other says you must have them at every practice. In any case, knee pads can't hurt you. Quite the opposite. They protect you from bruises and burns during falls. They keep your knees warm and also, to some extent, tighten your knees and protect them from injury. If you already have knee problems, see a specialist and use knee braces. There are many types on the market, from braces that support the knee slightly to robust braces in which the knee pads almost doesn't bend into the wrong position. Try what works for you, but don't count on the brace alone to protect you. I am an advocate of using a brace in acute cases for longer-term problems, but still, work on stretching, strengthening and stability so that you can put the brace away one day. So these are my advice and tips for preventing knee injuries and avoiding surgery. If you follow them, you will reduce your risk of knee injury. And it's clear that all volleyball players need healthy knees to perform. So prevention, exercise, stretching and other techniques need to be actively practiced. I'll see you in the next video. Bye.